My name is Kelly Parsons, and I'm a social worker here at Sanders Brown Center on Aging. We support the family and the person with disease here at the center in multiple ways. But today I'm going to be talking about long-term care and COVID-19. I do want to briefly mention some things that are happening in June. June 19th will be our family caregiver workshop. It is all through the web, so all virtual. This is in association with the Bluegrass Area on Aging, the Baptist Care Memory Clinic that Dr. Cooper runs, and the Alzheimer's Association, and of course us at Sanders Brown. And then we're also going to be continuing these webinars series each Friday of the month on June. So check the Facebook page or possibly your email for that information. All right. So like I said, today we're going to be discussing long-term care facilities and COVID. We'll first talk about the types of community living facilities that there are, look at care facilities specifically in Kentucky, and then move into the really specific concerns that COVID-19 brings up with care communities and ways to ensure communications and connections are still happening. So these are the things that we're going to be covering. If I move a little too fast or you're unable to write something down, I'll be giving my contact information at the end. And as Shawnee said, it'll be recorded to view at a later date. So let's get started. All right, here we go. So types of community living, this is kind of really important because we think of a nursing home, an assisted living facility, but we're not really quite sure what the differences are. And assisted living facility is really just an environment that's a home with amenities. So the services offered by assisted living communities can help with activities of daily living, such as dressing or laundry or house cleaning, and also provide nutrition attainment. So typically there's a large dining room in these facilities, and it's very social. And they can help assist with self-administration of medications. But it's kind of the lowest level of care a person might need if they're moving into an increased care setting. So assisted living is kind of the lowest level. And then we have personal care licensed in Kentucky. So personal care is really much more of a medical model, whereas assisted living is more of a social model. And personal care, there are rules and regulations. They have to have continuous supervision and monitoring of residents to ensure health care needs are met. They also can need to be able to arrange and order therapeutic services ordered by a resident's physician. Personal care, housekeeping, different things like that. And then you hear memory care a lot. And I want to touch on memory care because memory care is not regulated. The term memory care is not regulated in the state of Kentucky. Typically, if you see a memory care facility, it is licensed under personal care, although there are some exceptions. It can be licensed under assisted living. So you definitely kind of want to ask what level of care they are legally able to provide if you are looking at memory care facilities. But it just, in each facility will be different in how they provide memory care. So skilled nursing facilities, they provide a wide range of health services at any level of care. Assisted living and personal care, you have to be able to feed yourself. You have to be able to be a standby assist of one, so just somebody kind of lightly on your shoulder if you have to move from maybe the bed to the chair, the toilet, and you have to ambulate yourself, and that can be self-propelling in a wheelchair, a walker, but for fire safety, you have to be able to walk on your own or ambulate on your own. So just some quick information about the different types of facilities in Lexington, or in Kentucky, So just to get a look at the numbers, because this is affecting a lot of people within facilities, there's 211 assisted living facilities in Kentucky, 100 personal care facilities, and 287 skilled nursing facilities. And skilled nursing facilities really are the highest level of care. It's staffed 24/7. There are, we have pardon me, staff 24/7. You can be an assist of 3 people. You can really highest level. So, and there's 26,000 beds. Now, that doesn't mean all the beds are filled, but there's a little over 26,000 beds in the state of Kentucky licensed at a skilled level. So let's talk about COVID-19 and visitor restriction guidelines, because this is really hard. So the executive order came down for long-term care facilities, so skilled nursing facilities on March 10th. March 17th, the order came down for personal care facilities, and then on March 26th for assisted living facilities. Now, long-term care and personal care facility exceptions are end-of-life care, and assisted living, end-of-life care and as exception, and limited visitation that are deemed a temporary condition as defined by a state statute. And the temporary condition really just means that the client loses mobility and what is deemed a short time of mobility. And that's really, I think, for healthcare workers and physical therapists to be able to provide that care for people. So there is definitely a difference between personal care, assisted living, and skilled nursing facilities. And let's talk about what Team Kentucky has done really to make sure all of those Kentuckians living in these facilities are ensuring safety and quality of care. On April 18th, Governor Beshear enacted the Long-Term Care Task Force specifically to deal with COVID-19. As we know, I think in the beginning of May, or maybe the middle of May, the governor asked that all staff, or mandated all staff and residents will be tested. And this really helps with the opening back up guidelines that we'll talk about a little bit later. Something that you all might not know, there is a moratorium on skilled nursing facility residents. If they are not able to pay, there's a moratorium on discharge. So somebody, it was a private pay resident, has run out of money and cannot pay, there is a moratorium that they won't be discharged from that care facility. And COVID-19 surveys for skilled nursing facilities. Every skilled nursing facility has state surveys, and they come in and, you know, they're just checking records and making sure everything is done correctly, and that's yearly. Well, this comes from a national level, but it's COVID specific survey. So they want to know, is the facility set up to handle either COVID patients or ensure COVID personal protection is enacted and established. And you can find those COVID surveys for specific facilities. They're doing them right now, so more and more come online each day at the CHFS, the Center for Health and Family Services website. If you go to pages, cvres.aspx. And this can all be found also on Team Kentucky COVID website. So if you do ky.gov in your search bar, you'll see a big banner on the top that says COVID-19 information. If you click on that, you can get to the Center for Health and Family Services website with this information on it. Okay. All right, so moving forward, I want to talk about social isolation, intentional connections, because they're so important, staff training and communication, because it really is a team effort for everyone involved to make sure everyone understands what's happening and stays safe, both staff, residents, and loved ones. So first, I wanted to talk about social isolation versus loneliness, because they are two different things. So social isolation is the physical separation from others, and loneliness really is a subjective, personal sense of suffering or feeling alone or separated from others. And there are two different types of loneliness. There's reactive loneliness. So and this happens around life transitions. Say you get a new job, maybe you move to a new place, or go to a new school, or get a divorce. Those are all kind of reactive loneliness. And then chronic loneliness is really that continued subjective, so you're feeling it, sense of suffering, or being separated from others. So you can have loneliness and be surrounded by lots and lots of people, versus social isolation, which is a physical separation. And it's important to know really that about a quarter of adults 65 and older are socially isolated regardless of COVID-19. So this is something that has happened previous to COVID, will happen after COVID. Um, and loneliness, specifically chronic loneliness, has very clear devastating effects on health consequences. It can increase your stroke, your memory and thinking problems, hospitalizations, pulmonary, cardiac, all of those things can become affected if you're dealing with chronic loneliness. And we'll talk a little bit more about being able to screen for that. So how do you combat social isolation in during COVID-19? We are finding some really great outside of the box ways to connect when we can't physically be there. So social isolation, that physical separation, you can connect through technology. So this is Zoom calls or Facebook messaging, I believe, has the video app now. FaceTime, certainly if you have an iPhone. Skype, any other video type of chat services. A simple telephone call, window visits, and letters. So we're really kind of getting back. If the facility has a PA system, some facilities don't, but if facilities do, they can, kind of maybe play some music in the morning on the PA system to get everybody going and knowing that, they're not alone and that they're there with others. If your loved one in a facility doesn't have a smartphone, you might want to send them one. Make sure their name is very clearly on it. Make sure you send a charging cable that's clearly on it. If they're able to understand how to charge it, maybe write out or have a grandchild write out specifically how to charge it and how to turn it on. And then talk to the staff and say, I'm going to send this in and I need you all to help get my, mother, father, sister started in using this so that we can connect more often. Inquire about doorway life enrichment programs. They're not really doing the big group things, but these doorway programs, and I'll show pictures at the end, are really, they've really thought out of the box. There's doorway karaoke, there's exercise programs, because again, you want to make sure your loved one is physically moving in some way, shape, or form. That's really important for their mental health. That's really important for their physical health. And then there was a facility that the staff dressed up as COVID-19 and they gave everyone their own Nerf guns. So they had their own Nerf guns, but over the PA system, they announced, COVID, get rid of COVID. And so they walked through the hallway and residents were shooting the COVID with their Nerf guns, which is, it's a fun activity. And it's something that can connect people when they're not connected. So pen pal programs, I think, have gotten some buzz. Local churches, Girl Scout troops, any type of community organization. If you know someone, reach out to them and see if they're interested. And we'll see some of those letters a little bit later. But also, you want to celebrate, send care packages, celebrate those milestones, send balloons, send flowers. They can have those, and then you also really want to make sure that your loved one has things that they find comfort in. I can't say enough things about music, making sure that they're able to listen to music via Bluetooth, radio, or, a CD player, maybe even a tape player if you have one. But music really calms us, puts us in a better mood, and it's great for people with memory and thinking problems to be able to listen to music that they connect with, because music is something, it's one of the very, very, very last things that leaves us, is that rhythm that we've known our whole life. Photo albums are wonderful. So if you've got a bunch of photos at home, maybe make a small photo album. It doesn't have to be perfect. It doesn't have to be in chronological order. You don't have to time date everything in the photo album, but just send the photo album, and that will be certainly something that your loved one in a facility will really enjoy. So those are some of the few things to combat social isolation. And then I want to talk about intentional connection. And this is really for staff that are interacting with your loved one, and to ensure that they're doing it, because staff really need to use the resident's life story to ensure employees are making meaningful connections and not just managing their care. I know Bridgepoint has 5 facts on the residents' wardrobes about the person's life story. So whether a dietary person comes in, or maybe a physical therapist, or a life enrichment person comes in, whoever walks in that room, if they don't remember the life story of the person, it's right there for them to say, oh, the tomato plants are coming in. We're gonna be able to pick some tomatoes on the patio garden soon. If it says, master gardener, use a name that they're familiar with. If their name is Cynthia, but they go by Cindy, make sure staff is saying their preferred name. Make them feel valued and among friends. This is really a connection, a social connection that can help people in assisted living facilities, in personal care facilities, in skilled nursing facilities, and have a range of memory and thinking problems. It's, if you know that your loved one really loves flamingos, send them a bunch of flamingos, because the staff is going to open that box with them and talk about that with them. And then that's another connection that they've made with that staff member. So then the staff member, a month later can say something about, a possible flamingo that they see. And you really want to make sure that they're doing things that they connect with. There was a lady that clipped coupons every Sunday, and so the facility made sure she had a bag that had coupons and scissors that were safe for her to use, so she could continue that activity that she enjoyed. So really, that intentional connection with people is so important. So we talked about loneliness and social isolation, and we talked a little bit about ways to combat that. And this is really important because we need to screen for depression. We need to screen for isolation. And the number one sign of depression is loss of interest in previous meaningful activities. So if there was a resident who loved bingo, and they're now doing doorway bingo because everybody is being very creative and innovative during this time, and that resident doesn't want to do it, and maybe the next time they play, she doesn't want to do it again, that's a very clear sign. So ask if your loved ones are continuing to participate in the activities that they enjoyed previously. Combating social isolation and loneliness is very, very important in long-term care facilities previous to COVID-19, and especially because of it. So you also want to be aware of sleep changes or appetite changes. Are they verbalizing that they're letting someone down? So ask if there's been any negative talk or negative verbalization. Sure, we all are a little sad sometimes, but if this is constant, and if this is a change, if there's a personality change, and then, skilled nursing facilities have what's called an MDS. This is kind of their record keeping, and within that, they do have to keep logs of residents' moods. So if you are in those, I don't know how often they do them, either quarterly or monthly, but if you're in care team meetings, because family members are certainly encouraged to either phone in or be there via Skype or Zoom at this point, the care team meetings where everyone gets together and talks about that, your loved one and that resident. And you as the advocate and the loved one has so much to give to those meetings. But ask what their mood looks like on an MDS report. And keep in mind, the sense of where the person has lived has changed. activities have completely changed. The way they get their meals has completely changed. So it's a lot. It really is. And then you also want to be cognizant of how often your loved one is watching the news. It's hard, and there's a lot of news out there. And so sometimes, especially if people have memory and thinking problems, they can think what's happening on the television is happening in their room and in their own personal space. And so check in, see how often they're watching the news. Ask if instead of watching the news, maybe they can turn on some music, some Billy Joel or something. Have the photo album out for them. And if when you're thinking about memory and thinking problems, staff or residents might not have the initiative to get that photo album off the shelf. So ask if staff are kind of initiating and setting up in-room activities. I know there's a facility that has an activity bag that is very specific to people's life stories. So make sure that staff is commenting on that if there's something available at your loved one's facility, and that they are helping your person initiate activities that are meaningful, because that's really important. Okay, we're going to move on to staff training. We're all in a new normal, and staff ask questions. How are staff being trained on newly recommended precautions? What's the protocol in place for safety? I think the Willows at Hamburg at the beginning of this would, and still, but take temperatures of all staff members before their shift and after their shift. What policies have changed? How are new hires trained and screened? Do they have to have a COVID test? When people are entering the facility, are they isolated for 14 days? Are they getting a negative COVID test? What's the policy and procedures for that? And then, especially if staff is in a specific wing, are they being moved around for different wings? Because there might be some policies or procedures that say it would be better if staff stay in one place. And then there's new dietary staff roles. I know I think Sarah Christian Villages and other facilities within the area are writing letters to residents on their food trays, just as that intentional connection that's so important. So find out what the policies and procedures are, because it'll make you feel better about your loved one's safety. All right. So communication, this is so important. This is, I believe her name is Ashley. She's a student at EKU, and she made the national news because people that have memory and thinking problems, people that might be hard of hearing and read lips, if somebody's masked, you can't really see that person. So with statewide, communication with family, I know the Willows is calling family weekly just to keep them abreast of what's happening and what's going on. So with statewide testing, because every facility, skilled nursing facility, is going to be tested, what's the plan if a staff or resident tests positive? Is there an isolation wing? Because just because you test positive doesn't mean you're going to go to the hospital. So that's really important. So checking for staff and administrative team to check on the emotional well-being of loved ones outside the facility is important, because with these types of communications, family will know that it's not just an inconvenience, it's safety. Because a lot of families have guilt, that they're not able to be physically connected with them. Social media, phone calls, newsletters via email or posted somewhere, check-in pictures over the phone. We have used our our computer devices very, very differently now. But just that communication back and forth between staff and loved ones who have people in the facility. Okay, so when I talk to a few people, one of the things is, the biggest question is, when can we see our loved one again? And, window visits are wonderful, and maybe patio visits might be able to happen if the weather is warm. But I just want to kind of frame this for you. The Opening Up America Again guidelines through the federal government really are talking about assisted living and personal care. And the CMS, Center for Medicare and Medicaid Services, have very specific skilled nursing facility or nursing home guidelines. So the Opening Up America states that they don't have to they can't have evidence of a rebound of COVID and meet gating criteria. And gating criteria is a downward trajectory in symptoms in cases throughout the state, trending all patients. And then for hospitals, their care systems can't be overloaded, and that they have a robust testing program for all hospitals and staff. Opening Up America talks about visitation within the third phase, and we don't know when that third phase is going to happen. But it's also very clear that the states will provide that, and that nursing home task force within the state of Kentucky will really focus on these things. So people are thinking about this a lot, but it just has to be done safely. And then CMS guidelines, one of the things that their guidelines report is a baseline testing for all staff and residents, which the state of Kentucky is actively doing. And then if resident or staff does test positive, when that positive happens, weekly testing ability for that facility while there are positive either staff or residents there. And then protocol for staff or residents who refuse testing, isolation if they're showing symptoms, different things like that. But, each facility would come up with their own protocol. So again, phase 3 of the Opening Up America is when CMS recommends availability for visitors, but it's not going to be the same. It's social distancing, 6 feet apart. It's masks, it's hand washing, it's all of those protocols that are so, so important. And I wanted to say, just take a moment and say, it's really important that you get your information from a trusted source. Everybody is working very, very hard. The nursing home task force, the facility that your loved one is at, the CDC, those are all really good sources to get information. Okay, and this is a difficult time for everyone, and it has been phenomenal to see the ways that staff and facilities and residents and resident families have come together. If you see the ladies with the hats, that's a mocktail mint julep for Derby Day. This is the horse visits. This is all within facilities in Lexington. Fresh flowers, who doesn't, fresh flowers doesn't put a smile on anybody's face. Visitors from, the fire department. This family's playing tic-tac-toe in a window visit. And then, these beautiful letters sent by kids and older people and family members. It's just wonderful to see, and it really does help break out the day. There was one facility, they had an ice cream social, and so somebody recorded the sound of the ice cream truck, that ice cream truck recording. And so as they were going down, providing residents in their room, doors open, hallway, as they were going down, the cart was kind of looked like a little ice cream truck, and they were playing that music. So just some really great things that are happening during this time. Here are a few references, and here is my contact information.